Order, order. Henry Smith to move the motion.
Thank you very much, Mr. Paisley, and it's a pleasure once again to serve under your chairmanship, and I am delighted to have been granted this important debate, and I'm particularly pleased to see a number of members, particularly for a Thursday, from both sides of the House present to take part in it. I declare at the outset that I am the chair of the all-party parliamentary group on heart and circulatory diseases. Earlier this year, that APPG conducted an inquiry with the support of the British Heart Foundation to better understand patient perspectives on artificial intelligence. It found huge potential for AI to transform the lives of those living with heart and circulatory diseases, and a greater need for those affected to be included in the discussions about the development and adoption of these new technologies. Mr. Paisley, before I go further, I want to speak briefly about what AI is. Put simply, AI is the term which is given to a set of computer actions that mimic human intelligence. Our report outlines what separates modern AI, such as machine learning, from other types of computer programs, and is that they can learn and improve at tasks. AI is particularly strong at finding patterns and trends in data which are not obvious through human analysis. I've mentioned one type of AI, machine learning. This is where algorithms, a set of rules that a computer uses to make a calculation, are used to look for patterns in data and then uses these patterns to make decisions. It looks for patterns in many different types of data, from scrutinizing images to analyzing genomic data. Every day we interact with something that uses AI, from entertainment to online shopping, wearable devices to virtual assistants, chatbots to advertising. All of these, the use of AI is ubiquitous. Whether it is through faster or more accurate diagnosis, more personalized treatment, better targeting of demand, improvements in service planning and delivery, or better predictions, AI has the potential to touch upon all aspects of healthcare delivery and management. Mr. Paisley, our APPG's report, which was launched in May this year, entitled Putting Patients at the Heart of Artificial Intelligence, warns that the spread of misinformation risks undermining public confidence in the use of AI in healthcare. Therefore, the APPG has recommended that policymakers, parliamentarians, the NHS, charities, healthcare professionals, and the health technology industry should seek to engage and involve patients in the design, development, and diffusion of AI. If they do not, then developments in AI may not reflect the needs of the very people who could benefit from it. It is important to ensure that fake news and the desire for a quick headline does not undermine the public's trust and confidence in this important area of research and clinical practice. A survey conducted for the inquiry revealed that 91% of people with heart and circulatory diseases said that the public should be well informed about how AI is used in healthcare. 90% believe that it is the responsibility of the NHS to inform the public about the current and potential uses of AI in healthcare, and 48% of patients surveyed strongly support doctors using artificial intelligence technologies to assist them in diagnosing and treating heart and circulatory diseases. Heart and circulatory diseases, including coronary heart disease, stroke, and vascular dementia, are affecting millions of families across the UK. The halving of deaths from heart and circulatory diseases since the 1970s has been a major health success for the UK. However, these conditions still cause a quarter of all deaths in the UK and are the largest cause of premature mortality, particularly in deprived areas. Together, they make up the single biggest driver of health inequalities and cost the NHS in England at least £7.4 billion a year. As outlined in the long-term plan, this is the single biggest area where the NHS saves lives over the next 10 years. Ms. Paisley, in assessing the potential for AI, it is important to note the scale of heart and circulatory diseases in this country. The British Heart Foundation, who provides the Secretariat support to the APPG, report that heart and circulatory diseases still cause a quarter of all deaths across the UK, on average killing one person every 3 minutes. The number of people living with heart and circulatory diseases also remains high, at 5.9 million in England, and there are more than 42,000 premature deaths from cardiovascular disease each year across the UK. We must therefore utilise the enormous potential of AI across all of these areas to transform the way we prevent, diagnose, treat and support those living with or at risk of heart and circulatory diseases. In my own constituency of Crawley in 2017-18, there were some 11,000 people living with a heart and circulatory condition. Of these, 3,679 have coronary heart disease, 1,865 with stroke, 774 with heart failure, and 1,985 with arterial fibrillation. In addition, 16,682 constituents have been diagnosed with high blood pressure, including myself, and 7,555 with diabetes. Now, while these numbers may seem high, the British Heart Foundation tell me that according to the Quality Outcomes Framework data, Crawley is ranked as 548th out of 650 UK parliamentary constituencies for prevalence of cardiovascular disease. In communities such as Crawley, and indeed around the country, one of the challenges of introducing AI into everyday practice in healthcare is its potential to exacerbate health inequalities. Age, ethnicity, socioeconomic, demographic factors can influence access to the best technologies. Access to new technologies is relevant because AI is currently being implemented in consumer-facing technologies, for example, smartphones, which help manage adherence to blood pressure medication, smart watches that track and analyze heart rate, and voice-activated assistants, such as Alexa or Siri, that can act as useful reminders to take medications. Mrs. Paisley, as I mentioned earlier, the APPG on heart and circulatory diseases launched its report on AI earlier this year. Our group was grateful for the involvement and indeed the enthusiasm of the Secretary of State for Health and Social Care, who also took the time to speak at the report's launch. Given the number of people in Crawley who have heart conditions, I wanted to keep local residents updated about my work chairing the group. Shortly after the report launch, I wrote in my local newspaper, the Crawley Observer, about the importance of tackling such conditions and reiterated the salience of Department and Health and Social Care, ensuring that some of this government's increased funding for our NHS is used to address the use of AI and its potential in the health service. Mr. Paisley, it was very much with this call in mind that almost a month ago I welcomed the Health and Social Care Secretary's announcement of £250 million to be spent on the new National Artificial Intelligence Lab to improve the health and lives of patients. The Health Department have said that this AI lab will bring together the industry's best academics, specialists and technology companies, which will be working on some of the biggest challenges in health and care. This will be used to identify patients most at risk of conditions such as heart disease, allowing for earlier diagnosis and cheaper, more focused, personalised prevention. The new National Artificial Intelligence Lab will sit within NHSX, the new organisation that will oversee the digitisation of the health and care system in partnership with the Accelerated Access Collaborative. One of the key recommendations of the APPG report states that NHSX should set up discussions with charities and the public to explore the views and concerns of patients about use of AI in healthcare, and I'll be grateful for the Minister's assurances that through the development of the new lab, NHSX will indeed be exploring the options of patients and thoroughly engaging with them throughout what is an ongoing process. Ms. Paisley, in the last 5 years, we have seen AI go from struggling to identify images even of, say, cats, to being able to identify skin cancer in histological sections of biopsies, just as well as a team of specialist doctors with decades of combined experience could. In debate on this topic, it is easy to discuss issues in what seems like an abstract term, but when patients go to see their GP, they want to see their GP. In such cases, AI could be used to automatically create the GP's notes about their patient, reducing the time that the doctor will be looking at their screen, for example. There is also the issue of self-management. From dedicated apps people use while going out for a run to the most basic step counters, more and more people use their own devices on some level to keep an eye on their health. AI can be used more and more in this area as well. Patients could use wearable devices and sensors to manage their condition at home and in the community instead of in hospital. AI systems could then monitor for unusual patient-specific patterns, such as a deterioration in a heart failure patient, and then relay this information to a clinical team for further intervention. This also presents an opportunity to put patients in much better control of their own care. Our inquiry heard from experts from Cambridge and Oxford universities who told us that the NHS health checks could be better at distinguishing the risks of different types of heart conditions to ensure that the most suitable treatment can be received by the patient. On the 16th of August, the Department for Health and Social Care announced a review of the NHS Health Check service, which is offered to everyone between the ages of 40 and 74 to spot the early signs of major conditions that cause early death, including stroke, kidney disease, heart disease, and type 2 diabetes. While the NHS Health Check programme has identified over 700,000 people at high risk of cardiovascular disease over the last 5 years and has saved an estimated 500 lives each year, the Department of Health are right to say that there is potential for people to benefit even more from an enhanced tailored service. The APPG's survey of patients with heart and circulatory diseases found that 64% had at least some awareness about the potential futures of AI to diagnose and treat heart and circulatory diseases. However, only 70% of respondents were aware of any current uses. This represents a huge opportunity to inform patients as to the opportunities of artificial intelligence. People are becoming more and more wary about the use of their personal data. From cold calls to unsubscribing from mass emails, there is increased caution from people about giving up personal information. When it came to the APPG's inquiry, however, 86% of respondents were comfortable with their personal health data being used to help better diagnosed medical conditions. Policymakers should feel confident that patients support the use of AI in healthcare if it is done to improve health outcomes. Trust works both ways, of course, and it's important that those implementing policy and programs are open with the public about how their information will be used. Mr. Paisley, this is why patients and the wider public should feel an involvement with not only the details of what their data will be used for, but the wider work of the NHS to use artificial intelligence to improve our health service. In June, when speaking on the use of AI, NHS England's Chief Executive, Simon Stevens, said that from April next year, they proposed the funding of care so that NHS organisations who invest in world-leading technology will be properly rewarded for doing so. I'd be grateful for an update from the Minister on what form this is due to take, and I'm sure that an update from the Minister would be welcome if colleagues are to make representations with their own health authorities and trusts. Our report raised the issue of what patients need to know. Transparency is welcome, and it is important to specify what type of transparency as well as its intended outcome, in addition to being clear about whom the transparency is intended. Transparency can include outlining why an algorithm was developed, what types of data were used, as well as how development was funded. Some experts have argued that the black box for AI, the difficulty in understanding how AI models reach their decisions, is in fact not really a problem at all, as humans are equally as opaque on how they arrive at decisions. However, the ability to scrutinize, conduct quality assurance, and undertake due diligence are important parts of regulating the health system and ensuring patient safety. In November 2017, the National Data Guardian for Health and Care, Dame Fiona Caldicott, told the House of Lords AI Committee about the challenges of using patient data in technology, saying that, and I quote, "What we have not done is take the public with us in these discussions, and we really need their views." Mr. Paisley, this is something that needs to be addressed. If patients are to trust the use of AI in healthcare, they need to know they are a vital part of that journey. Our report also looked at the regulatory framework and how the development of such technologies, innovations, means that health systems are becoming more complex environments to regulate. At the same time, it is important that the regulatory burden is not added to, so that the spread and adoption of new innovations is not stifled. Our inquiry found that a balancing act between managing expectations and encouraging hope and enthusiasm is always challenging, but nevertheless important. When we say patients should be informed and clear on what AI can do for the NHS, it is not a tick box measure, it is to provide the clarity that is needed for better diffusion of AI. NHS England and NICE, the National Institute for Health and Care Excellence, should encourage the development and use of reporting standards for AI research in order to provide best practice for artificial intelligence researchers. This could also lead to greater recognition of quality in AI research, particularly amongst the media, policymakers, clinicians, and the public. Mr. Paisley, with regard to my own constituents, I've mentioned the importance of government and policymakers and NHS staff, all of whom have an important role to play in supporting patients. I'm also grateful for the secretariat support provided to the APPG by the British Heart Foundation, and I'd like to take a moment to pay tribute to the charity's hard-working volunteers, including those who I've been pleased to meet throughout Crawley, and indeed those at the British Heart Foundation shops, which are located in the Queensway and the Broadway in my constituency. There is much to welcome in the NHS long-term plan. Indeed, the NHS funding will grow on average by 3.4% in real terms each year from 2019-20 to 2023-24 is, of course, welcome. The funding increase we see now means the NHS can lay further foundations for service improvements. And thanks to our NHS staff, millions of more people are being treated every year. While services return to Crawley Hospital, and I continue to call for even greater provision, it remains the case that I think the worst decision in the history of Crawley as a new town was the removal of A&E in 2005. Our constituents expect to see improved GP provision, reduced waiting times, and enhanced frontline services. To conclude, Mr. Paisley, the APPG on heart and circulatory diseases welcomes the great strides that have been made in recent years to speed up the development and the diffusion of AI in the NHS. The Office for Artificial Intelligence and the AI Council have huge potential to bolster the UK's position as a world leader in AI as part of the government's AI sector deal. The Centre for Data, Ethics and Innovation can also cement the UK's leadership in ethical AI and make sure society can shape the direction of travel and reap the benefits of AI, and we hope that these initiatives will continue to be taken forward. The Chief Executive of NHS England has called for this country to become a world leader in the use of AI and machine learning, stating that exploiting the boom in AI technology can help meet the targets in the NHS long-term plan of making up to 30 million outpatient appointments unnecessarily, in addition to saving over £1 billion in what would have been increasing outpatient visits, for that to be reinvested in frontline care and saving patients unnecessary journeys to hospital. This provides us with a reminder that everything we discussed today in what I hope will be future debates in Parliament on this issue, patients must be very much at the heart of that. Thank you.